Well, if you all have made it here to the stage, right? You've been walking around, you've probably been inundated with AI and automation, and you're like, well, now what, right? It's everywhere. And how do I make a difference? How do I take all this new technology, these new platforms, how do I actually put it to work when you go back home, right? And how do you generate value? So we're officially in this era, right? We're here. We're not going back, right? This time we are definitely in the new age of AI. So when we get started here, with that backdrop, I want to ask you a few questions. If you can, humor me. Please raise your hand if you've talked about AI or automation in 2025. All right. Now, keep them up. All right. Now, have you implemented something with automation and AI in 2025? And have you actually benchmarked and gotten measurable value out of what you've done with automation AI in 2025? One person. Thank you. You are doing great, Caster. Now, you know what? Like, that's a really common situation. And that's a really poor situation because look how much money is going into automation and AI. So how do we do better? We should be able to do better. I'm hoping our panel here is going to help us. All right, I got a lot of really good people here. I'm going to be your moderator. My name is Rick Shepardson. I'm an EVP over Enterprise Application Services at Optimum. I've been lucky enough to start my career at Epic back in 2004. Got to work with Kaiser and Cleveland Clinic and UC San Diego, some of the best in the business. I also tried to do automation 10 years ago. We were trying to take tap badges and reduce the login time by a minute and navigate through the EHR. So a nurse at a bedside had an overdue med, got to the MAR faster, right? Save clicks. And you know what? There are better companies doing that today with automation. And we've made so much progress. So I'm going to open it up to the panel here. We're going to go a little round robin. We're going to get started. And I want you to each share a little bit about yourself, your role in your organization, and share what automation means to you. All right, Samir, we're going to start with you.
Absolutely. Hey, folks, I'm Samir Sethi. I function as the AI officer at Hackensack Meridian Health. We're a health system based out of New Jersey, a total of 18 hospitals, around 500 plus care sites. We've been at automation for a little over 2.5 years, as a result of which we have almost 190 automations in production today. That gives us around 180,000 recurring saving hours every year. So it's been an interesting journey for us. The way we think about automation, it's actually a bit of automation and AI together. We combine those two concepts or two technologies together because that's when we start to see value and the ROI come into us. We call it IPA, which is intelligence process automation, which is where we're emulating human function, and then we're, I guess, to some degree, emulating human thought, and we put that together. That's when we're actually starting to see ROI. I would say 50% of our use cases today have a mix of both. The remaining 50% is just basic automation, which I think does pretty well as well. But it's been an interesting ride. We've continued to go down this path, of investing into automation. As a matter of fact, our investments into automation today is a lot more than it is for AI, because we do start to see dollars come back, at least something that's hitting our GL, and our CFO is seeing impact of these things. So it's a pretty interesting journey for us.
Good morning, everyone. Theresa Meadows. I'm the Chief Digital and Information Officer at Cook Children's in Fort Worth, Texas, not Chicago. I know people get confused. This accent kind of leans towards Chicago. I get it. We are an integrated pediatric delivery system, and what that means is we pretty much can take care of kids from the beginning to the end. So we have 100 plus ambulatory locations. We have 2 hospitals. We have 3 joint ventures for surgery centers. We have a very large home health agency that does the state of Texas, and then we run a Medicaid and CHIP health plan for the state of Texas. So we have a very wide variety of different things that we can do. And, when I think about automation, I think about the human aspects. So when we're looking at projects where we're thinking about what should we automate, it really is to address, are we going to address burnout? Are we going to address staffing shortages? Without automation, we are not going to survive the number of staffing shortages that we're going to have. And we're not going to find more doctors, nurses, other people to do these jobs. And so what kind of jobs can we automate so we can use the humans that we have for the more important types of work? So when we're really early in our journey, I'm impressed that you had metrics in February and it's only February of 2025. We're still pretty early, and we're in the use case phase where we're picking our use cases, and we've got technology already selected where we're going through and determining, okay, is this really going to save me human effort in something that is maybe not as critical that a human does? Because I think if you start there, then the more riskier AI, people have already experienced some level of comfort with doing some of the automations. I think you can get more buy-in as you move up the complexity food chain to the AI and the smarter AI as you move up.
Louie, we'll give Matt a moment.
I'm good. All right, no worries. Hey guys, my name is Louie Gomez. I'm the Chief Technical Architect at Optimum. I've been about almost 20 years in the healthcare IT space, mainly working on implementations and staffing and support for ServiceNow, but also worked on Epic, electronic medical record, certified in a few different modules there and done some go lives there. For the automation question, really, since I do so many implementations, I always go back to the foundational data and core data. So what automation means to me is that we have clear, defined processes, because that really has to come first. Standardize those processes before we start to layer on any sort of automation. Otherwise, you end up with this, garbage in, garbage out. Are we automating something that's really not necessary, that we don't need to have within our systems, and then we're wasting time there?
Good morning. My name is Matt Sullivan. I'm the Chief Medical Information Officer at Advocate Health. Large healthcare system, 69 hospitals, 7 states. And so I don't think I can say much different than any of the other panelists. I like Samir's concepts of these are the things that we got to be thinking out in light of real ROI and non-AI ROI. And the staffing comment, that doesn't matter where you work. Staffing it continues to be an issue in almost every aspect of healthcare in today's environment. And I think that one of the things that I've been able to see from my vantage point is that the governance plays a huge role here, because there's a lot of people that don't really fully understand it in the organization, and they're always looking for help and how to get things through the system. I think we're going to talk a little bit about that. So that's me in a nutshell. I'm an emergency physician, but now I'm full-time informatics. So that's me.
Thanks, Matt. You asked me to pepper you with questions. I'm going to save that for later. But we are going to get down to governance a little bit. I think one of the biggest enablers to kind of kick off here is the evolution of the platform, right? I think a lot of you have probably worked at SaaS companies. You worked at, now we're in PaaS companies, right? Platform as a service. And you see all of these historical barriers being broken down. So now if you have a process that crosses between Epic and Workday, you can automate it with ServiceNow, right? Or you might be able to take one of your giant hypervisors that started out with your cloud infrastructure, and now they're building a tool for just about everything, right? And so how do you take these platforms and make something out of them, right? You're now taking the data silos away, you're taking the workflow silos away. The people are in all the platforms, the humans, right? So how do you make it easier for them to navigate all of their platforms? And now that we're squarely in the world of the platform, how do we make the most out of it? How do we keep implementing that automation in 2025? So I'm gonna hand it over to Theresa. And Theresa, why don't you tell me a little bit about what you've seen with your platforms and how you are getting the most value out of them?
Sure. I think platforms, who knew that we've had platforms forever? They just have a name now. Your EHR is a platform, your ERP is a platform, your automation is a platform. But what we haven't done well is how do we put those platforms together, and what are the interdependencies? Because there are lots of workflows, to Louie's point, that cross over from the EHR into the ERP, into some of the more administrative type systems. If you think about just medical credentialing is a great example where you're having someone credentialed in a platform. From the credentialing platform, it's going into your EHR, it's going into your ERP, and how do you automate those things and how do you connect them? I think the platforms, the opportunity it offers us is there's deeper partnership with those providers of the platform. So we can work more closely with them to build the integrations or the automation that we need between those platforms and really connect them in a way that they've never been connected before. I think the other thing they afford us is most of them are cloud-based technologies. And so a lot of agility, a lot of flexibility to be able to make changes pretty rapidly in those automations and really deliver, things we couldn't deliver before. An easy automation is just submitting a service desk ticket. If I'm in the EHR and I have a problem, the ability to have an automation where I can submit a service desk ticket within the EHR, it goes directly to my IT service desk without the doctor or nurse, whoever, having to leave that system, go to another system, and then automate it. And then the automation gets it to the right person in IT with nobody touching it. It goes through all the appropriate processes. So I think if you think about it that way, how do I reduce the number of touches in those platforms so I don't have to go to my EHR, then I have to go to my IT platform, then I've got to go to this. If you can build an automation across those, you get a lot of value. And so I think that's where you'll see with almost anybody who's implementing platforms is how do I make these interconnected in a way that makes the most sense for the workflow and the data and where the data resides.
I think part of the key too is some of them become competitive. So where's the edges of one platform start and where's the other one end, and how do you glue them together in the right way?
Yeah, some of that competitiveness is who's going to be the most willing to work with us on something creative, right? Because if I have to beg you to help me create an automation, I'm going to go to whichever platform is going to help me get to my endpoint quicker. And so the partnerships is where it gets really important there, and having flexibility in your platform.
Yeah, that's great. Yeah, the partnership and the trust, the innovation, we're all kind of reliant on each other because no one has all the answers, right? That's just not possible in this world that we live in. Samir, I know you've got a lot of answers. You know what? Which platforms are most meaningful to you, and what platforms are you leveraging, and how are you doing it?
Yeah, so for automation specifically, we have chosen UiPath. We have another platform that we used as a backup in case something were to happen, breaches and things as such happen. And now that we function on their cloud, it's always good to have redundancy. So that's what we've focused primarily on. I would say 90% of our automations are built on UiPath, and I think it's been pretty good for us. I just wanted to add a few things where we struggle with, even after 200 automations in production, is around how do we bring human into the loop? Because just us being in healthcare, it is important to have that, especially when it comes down to clinical use cases. I don't think we have any use cases even after all these automations that does not have a human component into it. At times it's the right thing to do, and at times it's regulatory required. And introducing humans into a platform is really difficult. We have a concept where we use human factor engineering, right? This is a better way of calling industrial engineering, I guess, right? Where we actually go through a process where we figure out how these platforms and these automations and these capabilities interject with humans, and how do we make sure the workflow works? Because if the workflow doesn't work, then we're not successful. We don't get the level of adoption that we're supposed to. So I think that's a really important point, and platforms do no justice to it, right? Which is because they want, for example, a clinician to work in some sort of a UI within UiPath is not going to happen. Instead, we have to iframe that capability into Epic. That's the only time it's going to work. So I think that's a really important point, is getting human in the loop somehow into these platforms, and these platforms are not friendly in that order.
So Matt, you are an emergency physician by trade, right? You got colleagues. Are you a human in a loop somewhere?
Boy, they hope not. Because I think you're right, Samir, that when you put a human in the loop, you you can actually destroy the thing very quickly, or you can queue it up and nothing ever gets done. So the answer to that is no, I'm never in the loop. I'm looking in from the outside, trying to make sure that all the things Samir was just saying, it's got to flow smoothly. I do like the fact that you've called out that we don't have any automations that run fully. I think there are places where that could easily be done, supply chain, maybe even coding and billing for the most part. Someone may have to push the final button, but there's a ton of work that could be done in automation that's pretty routine and pretty rote. So I think as we become more expert in this globally together, and I think as our healthcare sort of catches up with the rest of industry, I think we're going to be in a better place to see more automations run without humans. And then the question and the bigger question where I think you're going to go in a minute is, how does this go into the EMR and patient care? And that's a different section of topic.
It is. Yeah, it is a different topic. It's there's so many different automations that are coming through now. With ambient technology, I think is going to be a really big disruptor. You see some of these vendors here now. It's creating a whole new primary source of data. It's no longer a human operating and then having someone document it. Now you're taking the transcription another step further. So I think we're going to see a lot of craziness there. Do you agree, Matt?
Yeah, I think so. And I think there's some things that people have long held that are part of what healthcare does. But I'm looking out of an audience that doesn't appear to be young. A couple of you are young, but the rest of us have had to sign up for a colonoscopy. As soon as you decide that you've hit that age, an automation can send you the goo you're supposed to drink. It's a lovely experience for those of you who haven't done it. I think that could be automated pretty quickly, but we haven't really warmed up to that yet. We're still sort of wondering if that is a high-risk maneuver. Probably isn't, but it's something to think about. I just use that as a fun example.
Oh, I like your kind of fun. It's good. Louie, what do you think? Do you like that kind of fun and maybe more on point? What do you think is most critical to success within these platforms?
You want to let that one go?
I'm going to let the colonoscopy thing go. That's not fun to me.
Wait, there's a box for you somewhere.
with the goo, yeah. Okay. As far as what's important for these applications, I think this team is saying it correctly, is the interoperability. So all of your different systems that you have within your organization, and try to think of like your top three, right? You have your service management tool, something like a ServiceNow. You have your Epic that drives your clinical workflows, your ERP, and everything just works better together. So the interoperability where we can integrate from one system to the next, that I think is where you're going to get the most value. It eliminates the amount of swivel chair that you have to do. And it really helps with like data normalization, making sure that all your systems are talking together, but we're always talking the same language as it goes from one system to the next.
Yeah, that's that platform effect, right?
Yeah.
You can effectively swivel by the screens are swiveling now instead of the human swiveling, right? And it's all in one place. I think Epic's probably releasing something like 3,000 new modules this year, right? That's an exaggeration, but every different vendor, every EHR vendor is expanding, right? And there's a very good reason why. So it's obviously really interesting to see them evolve. And sometimes it might feel like they're chasing shiny objects. Maybe they're playing whack-a-mole trying to compete. Maybe they're chasing purple squirrels, right? Anyone feel like they're ever chasing purple squirrels, right? I feel like I'm chasing purple squirrels all the time sometimes. And it's all in the effort of creating value and solving things for the humans that mean the most to you and your organizations. And that's pretty tough, right? To drive a consensus, a collaborative definition of what's most important, what's going to create value. So, question, right? We're gonna start this time with Louie, right? And Louie, let's talk about governance. All right, we're gonna shift to governance, and so increasingly, right? There's a requirement of making investments that are smart. The foundation of it's demand management, right? How do you get the demand coming in? Why don't you tell us a little bit about how you define governance, how you think about it related to applications, analytics, and any best practices.
Yeah. So I define governance is really like a structured decision making. It's a team of people, and we have to really get a lot of different departments involved when we're making these decisions. It can't be made in a silo where it's just IT is taking the intake of these ideas and really making the decision on priority and value, right? We got to get the clinicians involved. And when we talk about platforms, it's really spread across multiple departments, right? You have emergency in there, you have billing in here, and you want to get them involved so they can be part of the decision as well. One of the best practice when it comes to governance is making sure you have an accurate way to really measure the value. So as ideas are coming in from multiple different departments, how are we going to put a value to those and decide whether something is going to be implemented or not, right? And once you have that value, you also have to align it to your organizational goals. And that's going to help you set that priority. Is this really something that we're looking to do in 2025? And then we also have to choose the application that we're going to choose to do this. Just because ServiceNow can do it doesn't mean it should. Just because Workday can do it doesn't mean it should. So we have to choose the right application and the right technology to make sure that this fits not only for the data perspective, but how do then our users going to interact with the system as well? How are we going to be able to support this long term?
That's great. Matt, I know you and your organization have done a lot with governance, looking at some of the things that maybe live long term or maybe don't. Do you want to share with the group your experiences and what your organization's gone through with AI and automation governance?
Well, I think, Lou, you hit on it. The governance components that all of us should have in place are evolving. So I've been in this business for about 15 years and watching that transition from paper to EMR to another EMR to now AI requires multiple iterations of governance. And I think we probably all suffered through that. The question is, why make a change? And so there's got to be a driver for making a change in governance. And I think AI is one of the things that we've seen in the last 3 years that we knew it was coming. You can't go to a meeting without talking about it. And automation falls sort of in that same bucket. Is this going to be done with or without a human in the loop? And to be honest with you, there's not a lot of people, certainly a couple years ago, that really knew the answer. And I'm not 100% sure that we have the answer because it's always evolving. But setting out and saying, look, here's our basic governance. All right, what about our basic governance can't tackle this AI or automation component? Do we need to find another set of governance that's managing AI? And then the other question is, how do those governance or approval bodies tie in together? Which is, I think, what you were getting at a little bit, Louie, which is, so if somebody wants to buy new software, it doesn't matter what you buy these days, it always comes with, and we do AI. And so and so now you have to have a group of individuals that are smart enough to understand what AI is. Is it different than just algorithmic processing, or is it really an NLP thing, or is it really truly a machine learning technology and it really needs to be vetted? And then how do you pull that out? And for the users, for the teams that are asking you to implement stuff, to be better, to be faster, that's a bump in the road, right? They don't want to have another set of hoops to jump through. So you have to be really careful to say, okay, I'm sorry, this actually has machine learning in it. We need to look at this from an expert's perspective. By the way, you're not the expert, but we have the experts. And that's actually a problem if you're a small healthcare system. I'm lucky. I'm in a big healthcare system. I do have a team of experts. A couple of them just ran away. I made some colonoscopy comment and they ran. So smart team. I think the question, though, is how do you then make that seem to the user that they raise their hand with an idea and you bring the number of experts to the stage to say, okay, we've got this. We're going to run this through finance. We're going to run this through our standard governance. We're going to run this through the clinical eye, which is very important. But we also have to pull it out and push it through an AI governance and evaluate, is this safe? What's the risk to the organization to do this? I think that goes back to sort of, does there need to be a human in the loop here? And so as you've built those components out, it's not just standing up an AI governance, It's actually how that governance integrates with what you already have and what other changes have to happen. A lot of times, in my experience, the things that have gone poorly run through your standard governance, and in the final hour, right before a contract is signed, someone says, "Oh, there's some AI in this," and we go, "Whoa, whoa, 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 what?" And then you have to back up and start over, and you slow the project down, cost you more money, cost you more time, and that's the stuff that people get really pissed about. So
do you have a central AI governance group or committee today that gets involved? How many people are on there? Is it cross-functional? Tell us a little about it.
yeah, so we do. We have stood up a central governance that mirrors the rest of our governance flows. And again, we have ERP governance, we have EHR governance, we have overall overarching governance for clinical oversight, we have a finance, and so all of these pieces, if you had to go to each one every month, you'd probably get 5 things done a year. So you have to really do it in parallel. We've stood up an AI governance that essentially takes the product in, the software, whatever you're dealing with, and they unpack it. And the data science team supports that. We have a ton of data scientists, but they're not all on the committee. It's a very nimble group, so that they can act quickly and return an answer while the thing is in stream to say, "You're fine," and that's okay. What we want them to say is, "Time out. This is going to drift really badly. This has no controls on it. This is dangerous. There's no human in the loop. Please don't implement this." And we've actually had a couple of those cases come through, and they were pretty cool ideas. Some of the stuff you've seen here today is really cool, but when you unpack it, you have to be very careful when you're dealing with human lives. And so we've had them say, this is high risk. Our recommendation is no. And then you got to be willing to run that through the standard governance and take that back to the constituent and say, "Hey, I'm really sorry. We're not going to be able to do this. You got to come up with we're going to help you come up with a different approach." Yeah. That's challenging.
It is. Theresa, I see you want to get in on something. Do you have something?
I do want to say, so this is big house, real little house compared to your house. And I think AI governance is hard. And so we don't have a team of data scientists. We don't really have any knowledgeable people on AI. I mean, I think we're all learning together, and I think most health systems are probably not as sophisticated as you are. And so one of the things we've been trying to do is, how do we find the experts to help us? And that's where we've kind of leaned on our platform vendors to be those experts, because we may never have a team of data scientists. I think I'm going to get one, though. I'm going to have one, which is going to be awesome, and I can't wait. And that's been a real struggle, because people want AI, and they want it today, and they want it yesterday, and they don't understand why it takes us so long to go through the iteration of deciding if this is good or not. In a platform, we can go relatively quickly, because what we're hoping is that the platform partner has vetted out some of the issues that you identified, but the smaller niche solutions are really hard for someone like my group, because it takes us longer to really vet, and then they don't always want to how their algorithm works. And so if you're not going to share with me the data I need and how the algorithm works, it really makes it hard for me to give you the thumbs up to move it forward. And so we look like bad guys a lot because of that reason, just because we don't have the expertise in-house. And so we hope that we will find more and more people who will be more open with the algorithm, the data that's needed, the workflows that are needed. If you're an informaticist, it's the best time in the world to be an informaticist, because your background is workflow and data, and that's what AI takes to be successful. And so we've kind of trained our informaticists to be AI people, for lack of a better term, because we didn't have the people to do it. So it's a super interesting time to try to figure these things out. But I just call them and say, "Did you test this already? They're your 95 AI things that you tested, and you found only like 3 really that true. Worked."
Like that's one of the things, is the collaboration behind the scenes, which we talk to each other. You kind of have to, even as a large scale organization. There's risk. And it doesn't matter your size. You want to make sure you're not going to step on.
It's fun to have friends, because I can just call and say, have you done any evaluation of this? And they'll go, yes, and it was not good for whatever reason.
That is the most fun part of my job, is connecting all of you people who know way more than I do or anyone else does, right? And you learn from each other. I watched it last night. Samir, you were horse trading some of your use cases with somebody else to see if you could align, right? You last year, I think I met with you at ViVE. We'll worry about the phone later, right? I think I met with you at ViVE, and you were working on a generative AI solution then. So you've made a lot of progress. Share a little bit about your governance journey. Share what you've seen be most successful or important in developing and piloting and deploying new solutions.
So we've had a few versions of this, I think similar to folks here. I think where the struggles are around your governance frame, it's easy to put a governance framework together. It's hard to get the right people that understand the impact of the technology. So I know we have sort of shifted over to the AI conversation, but let's go back to automation, right? When I'm speaking to leaders about automation, they're telling me it's going to save me hours, right? That's generally what everyone thinks about. My advice to folks is let's not focus on that first, right? Automation can do a lot of other things. Number one, accuracy, right? Humans make mistakes. Robots make less mistakes. So when you have use cases where accuracy is important, and this could be really leave the AI side of the house out of this. So no claim of, a robot trying to think, but just taking data from a screen on the left to a screen on the right. Humans do it and they make mistakes at times. They type the wrong key. Well, automation does not do that. So it's important. The point I'm trying to make here is that it's important to teach your governance people and the folks that are involved there that what this technology can do. And it's always just not ours, specifically automation. And sometimes it's also about keeping people on seats. There are jobs within our health systems today that we cannot hire for. And this is less of shortages, but it's more like supply chain, right? So the first use case I deployed, and this was 9 years ago, was actually a supply chain use case where a person was typing information in 3 locations. We could not keep a person on that seat. So we built automation to make sure, and these were just 3 people. It wasn't saving us a whole lot of money, but someone had to do that job. And we couldn't get people to keep that job. They would get bored out of their minds. So we built automation, and we did not need a human to do it. So I think taking this back, from a governance perspective, you have to have your leadership understand what the automation is for. And that's going to change over the years, right? At times it's about accuracy, at times it's speed. A lot of us here, by the way, survived on FEMA money post-COVID, right? The first use case at Hackensack that my team deployed was filing FEMA claims. I still remember one of the consulting companies that came in and they said, for you to just catch up on these claims, it would take you 6 months, which is filing these claims. We did it overnight. I mean, it took us almost a few weeks to build the automations, but when we turned it on, we showed back the next day, and all the claims were filed with FEMA, and the money started to pour in. So that's how you want to think about automation. It's always, and you want to teach your governance framework, what do we need automations for? And I think that's when you'll start to get a better sense from them where the urgency is, where the requirements are. And I think that's true governance in my mind. When we built, and now going back to AI, when we built the AI governance framework and a whole committee around this, people had no idea what it is. We had to spend 6 months educating them on what this tech is, what it can do, what it cannot do. And I think that's been quite helpful. So I think for me, the evolution of the governance process is actually more so the education of the leadership on what this technology can do. And then everything flows right through.
That's fantastic, right? I loved a couple of things. So you just brought us back to automation. And in many ways, automation is in some ways safer, cheaper, more reliable from a savings perspective, from an execution perspective. You're not reliant on, some algorithm in the cloud, right? Somewhere Sam Altman is probably crying because he doesn't want to open source his stuff, right? And that's going to be a problem when we don't have transparency into what's actually happening, right? And so, I think for me, one of the other things that I'm taking away here from Theresa, and I've been interacting with a lot of informaticists recently, they were kind of pushed aside in some ways during this whole EHR era. Like, oh, we know how to implement, right? We know the workflows. Well, now as we go forward, you need people that are living and breathing inside of your organizations, understanding your clinical workflows, understanding your operational workflows, your financial workflows, knowing where the bottlenecks sit, knowing where there's opportunities to drive automation that make real improvement, put money back in the pockets of the CFO so that he can invest those dollars back in your fund so that you can build some new cool stuff, right? So that's what I'm excited about. We are gonna wrap up here, and we got a little final round robin with our distinguished panelists who've made this so much fun. I want you to each go around. We'll start with you this time, Samir. All right, so what makes you most excited about the future of automation? What is the biggest opportunities, the most meaningful impacts? Where do you think that you're going to see the biggest benefit in the future? And if you had one final piece of advice for the crew, what would you tell them?
Where I see the future going is orchestration of AI and automation together, right? And maybe a few other technologies as well. A lot of people call it agentic AI, right? But the concept is very clear. We want a way by which we can orchestrate different technologies to work hand in hand, thereby reducing human intervention wherever it makes sense. And I think that's where the world is going to move to eventually. Today, we have silos of technologies where AI is being done separately, automation is being separately. There's a conversation around digital, but I think putting that all together through what a lot of folks are calling agentic AI, I think that's where it's going to happen. Think about the impact, and just let's become patient for a second, right? Think about, you pick up the phone and say, I need to make an appointment with my orthopedics, and can you reserve a car? Can you get me a car to pick me up at 5:00? And then when I get there, I'm going to need a chair and some help getting in there. And by the way, just call me and say an hour before to get ready. So these are things that are going to have to be put together, and the orchestration of, now what I just described was probably four robots, a little bit of AI, a chatbot making a phone call into the hospital system. All that's going to come together in the form of what a lot of people are calling agentic AI, and I think that's the future. That's when we'll start to see ROI. I predict that in the next 5 years, all of us, everyone in this whole hall, is going to have some level of an agent in their pocket, on their phone, right? The technology exists. They know that it's of value. They just have to be a commercial angle to this. So that's where I think AI is going to go. My advice to folks is invest ahead, right? I have a very fortunate CEO. I'm very fortunate to have a CEO that's invested in this. We started this journey 3 years ago, and I wouldn't call it that we have a blank check, but as long as you're producing, he wants us to keep going, right? And this has come through a lot of convincing, right? And saying that this is the way to go. So invest, go to your leaders, have a conversation, hire data scientists, get platforms that make more sense, get human factor engineering, bring that all together, right? And deliver products that make sense and actually deliver impact.
Pretty good roadmap. Theresa, what do you got? Most excited?
Can I just say ditto? No, I'm kidding. What I'm most excited about, as a nurse by background, I actually think this is the first time that technology is going to be helpful and not hurtful. Like, technology has been a consistent burden for everyone in the healthcare system. And I think we're finally to the point where and please forgive me, we've put in all the plumbing. EHR is the plumbing, the ERP is the plumbing, and it's capturing all the data. What's going to make us successful is the ability to capitalize on all those investments that we just haven't been able to do because the technology wasn't ready. Now I think we're at a point where the technology is ready and we're not ready. We're behind the 8 ball a little bit. And so I do think this is an opportunity for us to really evaluate workflows, the data that we have, how do we use it, and then how do we use it to really personalize that journey for the people who come into our organization. So he was talking about personalization. Really, what he was saying is, I know Theresa, I know what Theresa needs, and I'm going to help automate that journey through the system, whether that's wellness care or sick care or whatever the thing is. And that's what I'm super excited about. I think it's the best time to be in healthcare IT. We have the best jobs in the world, I think. Although most of the time we're like, this place sucks and I'm ready to walk on out of here, but it's the best time to be here. And the advice I have is, figure out how to tell the story, because that really is the important part at this point. If you're in a smaller health system, how do you tell the story to get the tool that you need to start delivering value? And you have to deliver it quickly, because people don't wait around for the delivery. And so figuring out the few use cases that would make the most impact and how do you deliver those quickly, and how do you educate the folks around you about why that would be important.
I will say ditto. I think, Samir, you said it really nicely. It's a nice progression up to what is agentic AI. I think that will be very helpful. My advice and my sort of central point is always to stay patient focused. We're in this business of healthcare, and this is how I got my start, is one-on-one patient care. And I think if we use all the concepts that Theresa and Samir have already talked about, I think they're 100% correct. And I think if we focus those to make patient care better, and by patient care, that could be efficiency for the nursing team. That could be efficiency for the pharmacist. There's a ton of people that support all of the care that we provide to patients. But we've also got to look toward outcomes, which is, if you do something, are patients healthier? Are they less likely to have catastrophic healthcare error? Or are their outcomes actually going to be better? And I think, to jump on to Theresa's comments, I think this is the time in healthcare where we have now the background, where we've survived the implementation of EMRs and ERPs, and everybody's sort of used to that. I don't think they're all very happy with any of it, but we have the option now to make people a little bit happier. You can call that burnout, you can call that resilience, you can call that just job satisfaction. But I think we can do that and change the outcome for patients. Now, unfortunately, it comes at a cost, and I'm very cognizant of that, and I'm also aware that in this country, we're spending a ton of money and the outcomes aren't particularly better. So I think as long as we are careful about that and we focus on patient care, then all the tools and all the things that Theresa and Samir have said are going to launch us forward, and it will be really awesome to be in healthcare. And I hope that's a very short time frame, maybe 5 years, but hopefully I'm here in 5 years and we can come back and say, hey, wasn't that fun?
I'm going to be here in 5 years, and I'm going to have an agent, and Samir's going to help me build it. And I might get Louie to help me with something too. So, Louie, what are you excited about?
Yeah. So something that I've already seen taking place, and I'm excited to see it keep going, is the use of the platforms. We talked about it a little bit earlier today, but seeing all the different departments now joining in on some of these platforms where we can introduce some of the automation to not just IT. Right? It was always IT that got to play with these fun new tools at first, or goes to the EHR. But now that we have these platforms, and the integration, interoperability between these platforms is getting a lot easier. So with easier integrations between the two, we can do a lot more. When we can do a lot more with these automations, we get better data quality, better patient outcomes, better results.
That's great, Louie. Thank you. And so, that's a wrap for us. I want to really thank our distinguished panel. They exceeded my expectations, right?
Okay.
I want to thank all of you for being aware and engaged. You all exceeded. Where did Castor go? He exceeded my expectations because he got that ROI this year. We're over at booth 1008. We are honored to be a 2024 Chime Partner of the Year. I love nothing more than learning and engaging with really smart people like yourselves. Come talk to us. Come talk to us. We'll sit around the stage a little bit if you have any questions. Have a wonderful show.